It is time for Health Beat, and it's Breast Cancer Awareness Month. Screening guidelines say all women 40 and up need an annual mammogram. That's the newest recommendation. But doctors say they're seeing more diagnosis in women who are younger than the screening age. I talked to a Sacramento survivor who fell in that category and an expert who says you have to advocate for yourself. At 5 months pregnant and 39 years old, Maria Cabos felt a lump. She told her doctors right away, and after tests, they said it was breast cancer.
I was really afraid at that time because I was pregnant and I wasn't sure what was going to happen.
Her care team came up with a plan keeping baby in mind. They decided surgery was her best option.
They had to do the surgery to stop the spread, and then they induced me early, so I had a premature baby. And after I gave birth is when I started the chemo.
She would undergo treatment for a year. Kaiser Permanente surgical oncologist Dr. Brooke Vong says she's seeing more women under 40 with breast cancer.
A lot of research is focused on mortality or will you survive breast cancer, but they also worry about recurrence and cancer coming back.
And research shows reoccurrence among this group is low.
I think for young women specifically, they have a lot of unique issues. So that can be oncofertility, and they're often, in their childbearing years. Financial toxicity, they're in their work years, and so optimum work years. Finding a partner and their self-image.
That's where she says the care team steps in.
Once you're diagnosed, really your team should come together, and a team for breast cancer is not just a surgeon, right? So it's a surgical oncologist or a breast surgeon, medical oncology often, and radiation oncology, and there's a whole other multidisciplinary team of resources.
For Cabos, that meant maternal fetal medicine and a neonatal team present at her surgery. Dr. Vong says even if someone says what you feel is normal, pay attention to it. Don't let it get bigger because cancers can grow. Cabos agrees and credits her baby for saving her life.
If I wasn't pregnant, my hormone wouldn't change, and I probably would skip the 40-year, the screening at age 40.
And a lot of people think that way. Cabos is healthy. I'm happy to report that. Her baby is healthy as well. She wants you to know that this is a possible outcome. Personally, I lost my grandmother and an aunt to this disease. I had another aunt who was diagnosed with stage 2 that survived when she had just had a clean mammogram 6 months prior. She found that lump all on her own. Early detection saves lives. I've seen it, and that goes for men too. If you want to learn more about screening and detection, you can head to abc10.com/links right now.